afternoon, everybody, and thank you for coming. I'm Dr. Tamara Topoleski with the Orlando Orthopedic Center. I'm a pediatric orthopedist, and I have been with the Orlando Orthopedic Center for 13 years. My practice is comprised of children ranging from newborn to college age and young adults. As I mentioned above, 82% of the small percentage of students who did report back pain attributed it to their backpacks. Of that 37% who complain of back pain, only a very small percentage, less than 20%, actually seek orthopedic care for their back pain. And those students who do seek orthopedic treatment rarely actually attribute their back pain to their backpack. Very often, they attribute their pain to some other source. One of the largest studies looked at backpacks that all the children carried. This was primarily comprised of the middle school population, and they found that the backpack weight ranged anywhere from 1/2 to 37 pounds, and the mean backpack weight was approximately 10.5 pounds. The interesting fact that they found was that 30% of the weight within the backpack was non-essential, non-academic items. Of note also was that the complaints of pain increased as the backpack weight increased as a percentage of the child's body weight. Based on these studies, we're unable to specifically quantify a recommended weight limit. However, we were able to summarize from these studies that a backpack weighing more than 10% of the child's body weight is associated with increased complaints of back pain. I'm often asked by the parents in my practice who attribute their child's back pain to the backpack whether a second set of books for home would alleviate their symptoms. As you all know, with budget cuts across the country from K through 12, a second set of books is often not readily available. If a school has a second set of books available for home use and a child has symptoms that are significant, we do try to ask the school if they'll help out and allow a second set of books for home use. The interesting finding in this very large study was that having a second set of books for home use did not necessarily lessen the weight of the backpack. This, I think, goes back to the fact that so much of what's carried in the backpack is non-academic and non-essential. The next most frequent question from parents is how their child should be carrying the backpack. Students who carried their backpacks in their arms in front of them did seem to report a higher incidence of back pain than students who used shoulder straps. Now, in the students who used the shoulder straps, the incidence of complaints was similar whether the students reported using 1 or 2 shoulder straps. However, when the pressures were measured, there was a significant increase in the shoulder pressures when one strap was utilized with a backpack in the low position down around the buttocks compared to one strap with the backpack in a higher position up above the waist. Okay, here we have our 14-pound backpack, and we are going to place both straps over the shoulders. The backpack needs to be carried up above the buttocks, and it needs to be flush against the child's back so that it's not hanging forward and it's not hanging down below the waistline. Another question I'm frequently asked in the office is whether or not carrying a backpack contributes to any other conditions aside from complaints of back pain. Scoliosis is common in the adolescent population. Scoliosis is an S or C-shaped curvature of the spine, and the good news is that there really is no scientific data to suggest that carrying a backpack contributes to the development or progression of scoliosis. So children, even with a diagnosis of scoliosis, may certainly use a backpack as long as they follow the guidelines for carrying them.